My name's Matthew Houde from Public Affairs and Marketing, and I wanted to thank you for joining us today for the latest Health Policy Grand Rounds, which is an ongoing opportunity to have a dialogue about significant healthcare issues. I'm delighted to introduce our guest today and the Republican candidate for governor, Mr. Ovide Lamontagne. But before I do that, I have a couple things I wanted to say. One is that Dartmouth-Hitchcock, of course, does not endorse any particular candidate or political party. But we are delighted to have this conversation among the candidates for this important office. I'm going to give a brief background of Ovide and then let him fill in the gaps. Ovide practices law with Devine, Willamette, and Branch and has been involved in numerous civic activities. For example, he served as legal counsel for the New Hampshire State Senate in 1991 and was appointed by Governor Merrill as chairman of the New Hampshire State Board of Education, serving from 93 to 96. He also served as president of the Daniel Webster Council, Boy Scouts of America, from 2002 to 2006, being honored in 2009 as their New Hampshire Distinguished Citizen of the Year. In terms of format, for people who might not be familiar, Ovide will speak for 20 minutes or so, and then we'll have an opportunity for questions from the crowd. And before turning the mic over, finally, I'd say we do have We Care, We Vote pins and bumper stickers, so in a shameless plug for that, I'd encourage you, if you haven't already, to grab them on the way out the door. And Ovide, of course, gets a hat.
I get the hat.
Thank you. So without further ado, it's my pleasure to welcome Ovide Lamontagne.
Great, man. Thank you very much. Appreciate it. Thank you. Thank you. Hoping this is working sufficiently so you can hear. Great. Well, I really want to thank you and Dartmouth-Hitchcock Medical Center for offering the candidates an opportunity to meet voters and to have a conversation. That's what the state's about. You know, politics is our state sport, and we take it pretty seriously. Sometimes it's a blood sport, but I prefer to think of it just as a great competitive sport where issues and ideas are at the center of the discussion, at the center of the game, if you will. And there's a critically important election going on right here in New Hampshire as well as in this country. And so I want to tell you a little bit about myself, my ideas, and then answer some questions, and then we can take it from there. I'm a fourth-generation New Hampshire native, the son of New Hampshire farmers, mill workers, and dentists. And if growing up the son of a dentist doesn't build character, I can assure you growing up with a name like Ovide does, guaranteed, toughest name in politics. And you know, I've actually been living the last 26 years in Manchester in the same house I grew up in, next door to my parents. We actually moved in there in 1986 in the neighborhood across the street across the yard from my parents. And in 1997, my mother said, "I've had enough of the big house. I'm the oldest of 8 kids." And I said, "Ma, I got a deal for you. We'll buy your house and rent our little house to you." So on Saturday morning of Labor Day weekend, 1997, moving truck comes to our house, and in 4 hours, the 2 families are moved. And my mom and dad are still my next door neighbors. They're alive and well. And if you've ever seen the show Everybody Loves Raymond, yeah, that's been my life for 26 years. And it's been just great to be next door to the folks. My daughters, my 2 grown daughters are 26 and 23. They know my parents as well as anyone. And my daughter yesterday, Brittany, 23-year-old daughter, just headed out to Fort Jackson, South Carolina for her boot camp because she's the newest member of the Hampshire Army National Guard. So it's been a little bit of an emotional couple days for us, but I'm proud of her. As a dad, I worry for her, but I'm proud of what she's going to be doing in terms of trying to serve our state and the nation. You know, I'm running for governor because I think we need leadership for a change in New Hampshire. We have a great state. We know that. Intuitively, we experience that every day. But there's so much more we need to be doing and we can do to bring ourselves out of really what has been stagnation. And still the depths of the Great Recession hit us, and we have 30,000 jobs short of where we were at the time of the Great Recession in 2008. We've seen some real anxieties, particularly in the North Country, within our communities with high unemployment rate. You know, it's one thing to say you have 5.4, 5.7% unemployment, which is less than the national average by a fair amount. But it's not acceptable when regions of our state suffer as they do with the kind of high unemployment we've seen. I remember just a few months ago being traveling in Colebrook and sitting down at Howard's restaurant on the main street with some business leaders and the bank president, Jim Tibbetts, and asking them about the situation there. And they're hardy people up there. They believe in their community. They want to make a go of it again, but they need some help. And I said to Jim Tibbetts, I said, you know, if I buy a product and I call an 800 number, why do I end up in India and not Colebrook? Why isn't there a call center here? And he said to me, Ovide, the reason there isn't a call center here is we don't have high-speed broadband internet. We're on dial-up still. I said, are you kidding me? I said, what would it take to bring this region of our state to a modern platform? Internet access, high-speed internet access so businesses can enter the global economy. He said, we put about a $600,000 price tag for this region. I said, $600,000? That doesn't seem like a lot. He said, Ovide, it really isn't. I said, why hasn't it happened? He said, a failure of leadership. Government hasn't been able to work with the private organizations in this area to put together a plan for putting in broadband high-speed internet. I want to be a governor that will govern to the need, not the averages. And so I think we need to develop a statewide economic development plan that looks at the regions of our state in terms of where the opportunities are for expansion and where the need is for raising the platform for competition. Because in the end, this campaign is about jobs and the economy and reforming state government so that we have the best state in which to do business, the best state in which to raise a family, and the best state to live in this nation. And that's going to help future generations be able to stay here in New Hampshire and enjoy the natural beauty and the wonderful aspects of being here in the Northeast and in the greatest state in the nation. And that's the kind of approach I would take. I have experience in business and government and the civic and charitable world, which I can bring to the governor's office to serve the people of New Hampshire. I've been a business lawyer at Devine, Willamette, and Branch for the last 26 years, one of our state's largest law firms. And I've served the last 14 years as outside general counsel of the Catholic Medical Center, one of our state's leading community hospitals. In fact, over the last few years, I've had a chance to work with some of your leadership team here, Nancy Formella, and the team that she's headed up to talk about doing an affiliation between Dartmouth-Hitchcock Clinic and Catholic Medical Center. And we were awfully close to doing something which I think would have been special for New Hampshire, would have been very effective. And I don't want to go into any particular details, do I, Neil? Other than to say, I hope that I hope you will talk to some of the people who worked on that team and say, what kind of a person is Ovide? Does he have a can-do spirit? Is he a rigid ideologue that can't work with people? And hopefully they'll say, no, you might not agree with all of the issues that Ovide stands on, but you can work with him. And I bring passion and experience as well as vision to the governor's race based on my experience in healthcare working for Catholic Medical Center. I also represented Franklin Regional Hospital, Community Access Hospital in Franklin, and helped to merge it with Lakes Region General Hospital. And saw how the beginnings of what could be an accountable care organization in the Lakes region sort of had its genesis in the early 2000s. And I've worked with healthcare organizations since my time practicing law with Devine, Willamette, and Catholic Medical Center as a client. I've also represented other business interests in our state. And I've been a business owner. I've been a business owner of our law firm and had to make the tough decisions, particularly during the times of the Great Recession, about how we're going to balance our budget, continue to expand our business, look for opportunities. We did something that no law firm, in my memory anyways, has done, and that is we started a business launch program right after the 2008-2009 decline, in which we offer to start businesses for free. If you have a business, you want to open it up, we'll form the articles of, draft the articles of agreement, bylaws, do all the paperwork and get you started for free. Now, we hope you're going to be very successful and use the firm as your law firm. But that's the kind of innovation that we need to kickstart our economy. That's the kind of an innovation I'd bring to the governor's office. In government, I served as chairman of the State Board of Education, overseeing our elementary and secondary schools. I did that in the mid-90s. Took on some initiatives that I think were very, very helpful to our state, like actually accepting federal funds. Are you shocked to hear this? For a school-to-work program, helping our students who are in vocational education particularly find a way into the workplace and to the workforce. We reformed our teacher certification standards so that professionals could move right out of the workplace into the classroom without having to spend 2 years in education limbo. They could get their teaching certificate, if you will, while they were working in the classroom and actually teaching. We brought New Hampshire Educational Assessment Program to life, a teaching and assessment tool with our students, and did a lot of other things. So when you hear the television ads or see them, there's much more to me in what I did with the State Board of Education than turn down, and I did turn down Goals 2000 money, which was money by the federal government to expand bureaucracy in our schools and have the federal government do way more in the day-to-day work of our schools, and I thought was appropriate. I make discernment. I discern the decisions I make with the data I have and the information to move forward, and I think we made the right decision then. And then I've worked in the civic and charitable world. You know, you all know this because you're in a wonderful profession of healthcare, but there are great organizations in our state that provide that safety net to our citizens. People with special needs being served by Easter Seals, on whose board I served. Area organizations, area agencies like the Moore Center, and agencies that work in partnership with the state to provide adult behavioral services to our citizens. I think of the food bank in which I served on the Capital Committee, founded by New Hampshire Catholic Charities, seeing that there was a need to provide food support to the pantries of our state by taking surplus foods from stores, and rather than destroying that food, bringing it into service so that people could have access to it. And today, and that food bank, by the way, was started in 1984. Today, the food bank serves about 400 pantries, which serves about 120,000 citizens in New Hampshire, almost 10% of our population, over the course of the year. Not every day of the year, but over the course of the year, 120,000 of our citizens will come to a local pantry for some help, to make ends meet for their families. And that's all privately run, not-for-profit organization. So we've partnered in many ways, government and the civic and charitable world, to provide that safety net and that opportunity for our citizens. And not all of our not-for-profit organizations are directed towards direct services. A lot of them are arts organizations, and we've seen this around the state where we have great resources available to enhance the quality of life for our citizens. Coming from that experience, I will be a governor that will work with the private sector, and particularly the charitable organizations, to make sure we continue to have the safety net in place and build on that experience. Now, my plan is called the Prosperity Agenda, and you'll find it at my website at ovide2012.com. That's OVIDE 2012.com. Don't forget the E. And there you'll see my strategy for balancing our state budget without raising taxes, for reforming the regulatory structure in our state. To put a business advocate in the governor's office is going to be a troubleshooter for businesses when they run into an issue with permitting, licensing, or some regulatory overreach. And that business advocate will speak for me and get the job done working with our regulators or agencies. I also have a business profits tax and business enterprise tax reform plan called the EASY Plan to lower the business profits tax and to provide some incentives for our businesses to create jobs tax-free, and a number of other changes we'll make, and you can see that in my plan. And then we have education, healthcare initiatives, energy plan. It's comprehensive. It's pro-growth for free enterprise and to create jobs through the private sector. And I think if you compare my plan with my opponents, you'll find a stark difference between the two of us. You'll also find a stark difference between the two of us on policy and matters. Now, Maggie was here with you earlier, I guess last week. And I'm sure she told you about me. I'll tell you a little bit about her, but I want to focus about more of my plans than about her. There is a stark difference. As Senate Majority Leader, you should be aware of this, that Maggie led the charge to take $120 million out of the JUA, which is the Joint Underwriters Association Medical Malpractice Fund. That's the fund that's been created in partnership with the state, but by the private sector, doctors essentially providing medical malpractice insurance coverage in the state. And Maggie thought it was a good idea to take $120 million of those reserves paid for by the premiums of physicians and to take those dollars and to fund state government. Rather than reducing expenses, she wanted to take the money out of the healthcare system. That's what it is. And I've challenged her about it on the campaign trail. And she says, oh, well, you know, the federal government's going to take that money anyways. She doesn't say, no, that was a mistake. She says, we should have done that. The Supreme Court said that was more than a mistake. It was an unconstitutional taking. The attitude, unfortunately, that she brings to this is that your money is her money, or government money. And that's what that example shows. In the middle of the night in 2009, the budget that she constructed and takes credit for included something that was inserted at the 11th hour called an LLC tax, a tax on small business. No hearings, no comment. It ended up in the budget, and when people found out what it was, they went up in arms. They said, this is adding a tax burden at a time when we can least afford it. But that was her strategy. The budget that she campaigns on was actually $300 million short after all these things that were built into it were discovered. The governor had to bring the people back, the legislature back in to fix that budget, the $300 million shortfall it had in it. And then when it was over, this legislature inherited a budget essentially, or a challenge, because about $800 million structural deficit was there, and they made some decisions that I wouldn't have made if I were the governor, like not funding the dish. Now the dish, you all know, is the Medicaid, and basically the disproportionate share payment. I was legal counsel to the state Senate in 1991. I saw that deal come together. And there was a deal is to tax the hospitals with the Medicaid enhancement tax and to assure that that money would come right back to them, so there was nothing, it was a net revenue loss for the hospitals. And that system worked for 19 years. The value proposition was that the federal government was going to match some of those dollars so the state would have enhanced revenue. Not to fund the dish was a breach of, I believe, the agreement, essentially, that was entered into. Unfortunately, not written anywhere, but understood. The hospitals would be simply a conduit and not the source of government revenue. Now, that's a serious issue we need to fix, and we're going to fix. And I'm committed to this because I've seen it up close and personal, not just by my own legislative experience, but my work with the hospitals of our state. And this is something that I want to go back to Washington with and to take a look at what we have on the ground, what we're doing, how we're dealing with Washington and Concord, and figure out a way to fix this problem. It's a serious issue. And I'm preaching to the choir here about the failure of the funding. To say there aren't challenges facing us would be to gloss over what is staring everyone right now. We have challenges going forward. I'm optimistic that we can get the job done if we work together. If we find the best and the brightest of our state to work on policy matters, whether it's education, healthcare, or other areas, we're going to be able to come up with the right answers for our state. But it has to be state-based. I don't look to Washington, by the way, for answers to our problems or really for solutions. I look to us to work in partnership with one another. Two things I would leave you with before we take questions. If you go to my website, you'll see something called Ovide's Oath, which is my 10-point pledge to New Hampshire voters. Yes, it does have a pledge against a broad-based sales or income tax, and I'm committed to that pledge. But it also has this pledge, that I will sign or veto any bill that comes to me. The New Hampshire Constitution allows the governor to sit back and watch bills get passed and become law without his signature or her signature. The governor doesn't have to do anything, frankly, when it comes to legislation, and take basically a completely detached role. Governor Lynch did that, and so did governors before him. I'm saying to the people of New Hampshire, notwithstanding that provision of the Constitution, I will lead and I will act. And for better or worse, I'll sign or veto any bill that comes to me, which means I better know what's in those bills. And the legislature better find out what I think about them, because we're going to have some issues after the process is over, and I'll be hands-on. Second thing I want you to know is I'm not going to use my party label as a speed pass to access or a barrier to entry to the governor's office. I think it's important that people understand the governor's office is the people's office, not any one person or parties. So I'm telling people, and I've said this through the primary, and I was criticized for it. I'm going to check my party label at the State House door and go in that governor's office and be the people's governor. Sure, I'm a Republican and I'm a conservative, and I'll apply conservative principles when I make decisions, but I'm not going to use the party label as some barrier to us working together. If you have a solution to the state's problems or a problem yourself, there'll be a place at the table so we can work together. And to the extent we have shared goals, we're going to get the job done. And that's the commitment I'm making to you and to the people throughout this state. It's an important one, and it's one that I hold dear. This is the governor's office. The governor is like a small-town mayor in most other parts of the country. And one of the reasons Governor Lynch has been popular is because he's there at state celebrations. He responds to natural disasters. He's been a hands-on manager when it comes to managing. I'll be one of those governors too, but I'll lead on policy. I'll invest political capital to try to move the ball for New Hampshire. And I ask for your vote. I ask for your support. And if you're inclined to be supportive in this last 2 weeks, we're in the true red zone right now. The last 2 weeks is when people start to make decisions who have decided, who for whatever reason haven't committed yet. And I need you to talk to your neighbors. I'd like you to talk to your neighbors, friends, family members, and have a conversation with them. Tell them the negative ads they're seeing on TV is distorting the candidates. Go to the website. Evaluate the positions the candidates are taking. See their history and their experience. I'm applying for a job. You're the hiring office. You're the HR director, every one of you. So what do you look for? Credentials, experience, vision, plan, and ability to execute. And in the end, I hope you'll conclude that I'm the person ready to serve New Hampshire as your next governor. So thank you again for giving me an opportunity to speak with you, and I'd be happy to answer any questions you have. So thank you. You're welcome, Matt.
While it may not be a combat sport, it is a contact sport and a high contact sport. I was saying earlier that New Hampshire voters don't make up their mind until you're in their living room for the fourth time. So I'm sure if you haven't been in each of these people's living rooms, then they're going to have questions for you. So I'm going to open it up and just ask you to introduce yourself before you ask the question. So thank you very much, Ovide. And who has the first question? Nancy. No introduction necessary.
It wasn't a plant either. I'm Nancy Formella, and it's my pleasure to be here today. I really want to get down to it now, Ovide. This Medicaid thing is a mess on so many levels. We have PPS hospitals and critical access hospitals really in controversy with each other. We don't really know how to do this at a state level, at a federal level. What exactly, how would you move into that situation, and what exactly would you do to help us resolve this?
Well, could you ask me a hard question? That's a very good question.
I want the 10-point plan.
The 10-point plan. Well, let me just take it at sort of a 30,000-foot view. Medicaid is present in our state outside of the hospital too, right? It's the insurance plan, if you will, and the safety net for individuals with special needs, senior citizens who don't have the resources through Medicare and other programs to get long-term care or health care, and poor women and children. It's a defined group of people we're trying to serve through Medicaid. But those people get served through Medicaid also when they're in prison, when they're living in the community, they go to community health centers. And there must be a way to take all of the Medicaid resources and allocations and start to look at that as one entire package rather than what we tend to do in state government, and that's a silo. That's to sort of disaggregate these programs and not work together. And you probably know where I'm going with this. If we're going to have a medical home model, thank you, Dartmouth Medical Center. If we're going to have an accountable care organization, we need to be able to align these resources and the care that follows so that when a citizen is in Medicaid, they have a primary care physician or a primary care access person who's going to help to oversee their care. That's why I'm optimistic about Medicaid managed care for at least health care provision. So we're going to try to bring in some oversight to make sure that people are getting the services they need at the right place at the right time. And that's going to be high, and that's not going to lower the cost. That's going to enhance the quality and in the end lower costs because people will be getting the right care at the right place and at the right time. So I think we need to take a look at our agreement, our plan with the federal government and take stock at this. And I know that you know this, there's been a lot of tension between New Hampshire and Washington, not just on Medicaid, but other federal programs. And we need to go back and start to redesign this program. And then what we need to do, I think, is to make sure that we, to the extent we're using Medicaid and the healthcare system, the Medicaid part of the healthcare system to bring in new lives. And that's what Obamacare calls for, essentially taking the Medicaid system and taking healthy individuals, bringing them into health insurance through Medicaid. I would prefer not to use Medicaid for that purpose. I think we need to have a private insurance exchange where you have many more insurance carriers than we have now, and that means looking at our own laws, rules, and regulations. And then having a high-risk pool that works with that private insurance exchange. So if I'm a working individual that would otherwise maybe qualify for Medicaid under Obamacare, I'm going to access the private insurance market through the private insurance exchange. And if I need some coverage that I can't afford, high-risk pool will be there to bridge that gap. So I have a plan that essentially is being managed by the private insurance marketplace, working with the providers and me as a patient. And I think that's going to be a better solution than simply turning over, again, the qualifying individuals into the Medicaid system. And the estimate is could be from 30 to 50 to 80,000 new lives brought into Medicaid. I think there's a better way to go here. If I were able to write my plan with the federal government, I'd want to block grant Medicaid so we have maximum freedom in New Hampshire to design the delivery system that works for us, rather than having to jump through all the sort of the unfortunate rules and regulations. The reimbursement requirements are just very difficult to navigate. And to give us, planning with our providers, our insurance companies, and our citizens and businesses, more flexibility there. So we shouldn't be at loggerheads with one another. As providers, we should be working together. And unfortunately, the system of the outside forces is making that difficult, if not impossible, to do. It's not an easy answer, but it's the right approach. I think it's the right approach. I have more faith, by the way, in the people in this state and in this room than I would any bureaucrat in Washington who thinks they know how we should be providing health care to our citizens in New Hampshire. That doesn't mean we turn away the money. That doesn't mean we turn our back on Washington. It means we're going to work together, but we're going to be in the driver's seat, and they're going to be in the passenger seat while we tell them where we're going and how we're doing it. It's a different approach than other people who may have spoken about this issue have.
Hi, Jay Bucky from Department of Medicine.
Hi, Jay.
How are you?
Good.
On your website, you say you want to reform the certificate of need process. Could you explain what you mean by that, what you have in mind?
Well, there's been legislation that's been passed to essentially eliminate certificate of need over the next 3 years. And I do think we need to get into more of a free market environment. I was opposed to the idea of just turning off the switch and eliminating the certificate of need process, which essentially is the government's way of rationing or allocating healthcare resources so that you only have one, let's say, cardiac center in the region, depending on volumes and so forth. And what we found is that by manipulating the marketplace, we've really eliminated competition and the types of forces that would actually lead to higher quality, lower cost in the end. So my view would be to make sure that we don't undermine the commitment of resources, capital resources that have been made by organizations that are longer than 3 years in terms of buildings and programs, contracts with physicians. I mean, I know this, again, from my own work, that Catholic Medical Center has New England Heart Institute as part of its delivery system. And contracts entered into were much longer than a year with cardiologists and others, and based on the assumption that CMC would have the certificate of need for hearts in Manchester. And that's been true for other healthcare providers who've relied on the certificate of need. So as we transition into full competition, it has to be done systematically. It has to be done with an awareness of the effects on the market. So at least this 3 years gives us an ability to plan. And if it needs an extension for service lines, and we should look at that too. But it has to be rational. It can't be just a knee-jerk reaction. And I was very much opposed to the idea that you allow a private cancer center to come into New Hampshire and set up shop and not have the burdens of providing care to citizens who didn't have insurance, who were Medicaid beneficiaries, when the competitors were obligated to provide those kind of services, which obviously drive up cost and make it uncompetitive. And the certificate of need laws were part of rationing on that level too. So that's why I think we need a systematic sort of unwinding of the program, but not in a way that disrupts the delivery system we have now. As we phase out of it, we've got to give our hospital providers, our healthcare providers generally, the ability to plan for this.
Good afternoon.
Good afternoon.
I'm Mary Evanovsky, and I work in the ambulatory care services. And so I'm one of the people on the line. I'm not 100% sure what I'm going to do. I would feel I really kind of liked that we had a Democratic governor and a Republican Congress until the scales tipped last year to such a degree, with so many freshmen Republicans coming in and with a just say no attitude, in my opinion. And I'm worried about a Republican governor with a Republican Congress just really losing the balance of what we've had here for so many years.
Well, I thank you for that question, and I've heard that concern expressed elsewhere too, so you're not the first one to raise that. One of the reasons that I'm taking the pledge I'm taking, which is to say I'm going to sign or veto any bill that comes to me, is to let the people of New Hampshire know I'm going to be on the job full-time working with the legislature. Now, I don't know who will be the majority, who will have the majority. Will it be the Republicans for both the House and the Senate? It's hard to tell right now because I think this election is close on a number of levels. But I'm going to be, as the governor of New Hampshire, you're the head of the executive branch, not part of the legislative branch. And I have my own views about how things should happen, and where I've already had some healthy tensions created among my friends who are in the legislature. I don't agree with, I've been critical about the budget they put together. I've been critical about other issues that have come before them. We've had occasions for many years where you've had a Republican legislature and a Republican governor. And there have been challenges, and people have worked it out. But the governor is not a legislator, and has to act independently, has to have the strength of character and the courage of his or her conviction to stand up to the people who may have a very different view in the legislature, Republican or Democrat. Same thing with the judiciary. You need to be able to hit that balance. People who know me know that I can work with people who don't necessarily agree with me politically. And I think that I'll be an important balance in Concord if I'm elected. And something that really is important to me as well is decorum. The way we present ourselves, and I'm mindful always of the young people in our state. If they're watching adults, and you see this sometimes in town meetings or other board meetings where people really get into a heated debate to the point where they're disrespectful, spiteful, hateful, that undermines our process. We ought to learn to agree to disagree respectfully. And I'll be like that because that's my upbringing. My mother would let me know real fast if I couldn't work in a positive way. And I think that's what I would bring. But on policy, there are some issues we'll definitely agree on. And Governor Lynch and I, for example, worked on a constitutional amendment on education funding and policy. And we agreed with language that basically restored local control over education policy and funding and required targeted aid. Some of the conservatives in the House were opposed to that. I'm disappointed they were because I thought we should have put a constitutional amendment on the ballot for the people. I can work with Governor Lynch. I did. And I can stand up to some of my opponent or some of my own Republicans who disagree with me and let them know why I do.
I'm Maudlin. I'm the chair of the Department of Pediatrics here, and I apologize if you may have already addressed this. I unfortunately had to come in late, but a well-known historian has remarked that civilizations are ultimately judged by how they treat their children, and I'm not certain that the current legislature has distinguished themselves in that regard. In that, with withdrawing for Dartmouth, $40 million from a Medicaid program truly has had a harmful effect on children in terms of our ability to care for them. And we've seen that literally on the front lines here. So I'd be real curious as to what your thinking is with respect to health care of children in the state. And I know that there's a point of view that if we just give their parents, mom and dad, a job, then everything will be taken care of and we don't need to do anything else. But I'll be very honest, us here on the front lines see that as not holding much water, to be honest. And so I'd be very curious as to what your thinking is about this.
Health care for children is like health care for, frankly, anyone else, although I think they're a more vulnerable population, certainly. And I do think, however, that economic recovery, economic growth, and prosperity is going to help a lot more families get out of the dependency and actually get themselves into the health insurance marketplace. So I don't discount that completely, but it's not the only answer. It's got to be part of an overall approach. My wife and I are foster parents of a special needs young man who came to us when he was 2 weeks old. Because he was a ward of the state, he was a beneficiary of the Medicaid system and a patient whose services were reimbursed by Medicaid. We worked with early intervention services at Easter Seals. We have worked now with the Moore Center for adult behavioral services for him as he lives in the community. He needs support because he's quite challenged. And actually maybe we're the ones quite challenged. Anyone who's lived with a person with special needs know you're the beneficiary being with those folks. They're wonderful people, and my foster son has taught us a lot more about life and about the significance of life than we ever taught him. But I relate this story because we've had to deal with the state all the way along with his care. Special education, not only health care, but special education as well. I'm committed to funding the waiting list, for example, for people with special needs, so they don't languish between the time they exit the educational system at 21 and the time they find behavioral services. A lot of these citizens have supports, developed skill sets that need to continually be reinforced. In terms of access to health care, we need a primary care system that works for our children as well as our adults so that they have access to health care right at the beginning. Community clinics and community health care systems are part of the delivery system. And I want to continue to work to make sure we leverage the resources through our community centers. And it's not always about funding. It's about allocating the resources so that, the right healthcare services are offered at the right place at the right time for our citizens. And the young citizens of our state, the children, are the ones that are most vulnerable as they mature if they're not taken care of. Then we have lifelong issues if they're not taken care of. So working with education, working with community centers, working with state government in terms of reimbursement has to be part of the overall mix. And this is where, and I am thinking that we're targeting or we're looking at children who are of families with modest means or are not able to support themselves at all. That's the high-risk population. And that's why I'd like to go back, as I said, and redesign perhaps our Medicaid delivery system, our Medicaid plan, that is much more focused on the care at the early end of life to make sure that we have children access health care early on, again, with the right providers, the right reimbursement. And that means, I think, redesigning our model.
This is an economic development question. I tend to believe that the economy is better, it solves a lot of healthcare issues. So if you take, say, the three buckets of economic development are attracting new businesses, helping establish businesses, or incubating small startups,
Right.
and you have to pick one of the three to put the majority of the resources into, which do you think most benefits New Hampshire?
Well, it depends on the size of the business you could recruit to New Hampshire, but I do think you have to start with the people who are here, the businesses that are here, and help them not only sustain themselves, but to expand here. Oftentimes people feel like, well, if you're the new kid on the block, you get more attention, and sometimes that's true. But for the businesses in state now, the domestic businesses, we need to encourage them, or help to encourage them to grow. And one of the parts of my EASY plan, the business tax reform plan, is to provide a 5-year tax holiday for new jobs that are created in New Hampshire. And how that works is essentially the business enterprise tax, which works in partnership or parallel, if you will, with the business profits tax, actually increases taxes on a business, even if it's not making a profit, by the number of employees that work at that business. And so my plan would call for a tax holiday for 5 years for new jobs that are created by these businesses, these job creation businesses. That's domestic. That falls on behalf of the domestic companies. Companies that would come to New Hampshire also, I want to incentivize them by changing the formula by which we assess the business profits tax. Business taxes are, for a company that sells in more than one state, is determined by an apportionment formula that looks not just at sales factor, but also the property you own in the state, and also, I believe, investments that you've made or borrowings that you have in the state. But there are like 3 factors. I say go to a single sales factor. So if I'm a Massachusetts company and I'm selling in New Hampshire and I move to New Hampshire, I don't increase my tax liability by making the move. Just look at the sales activity in the state, a single sales factor, I think will allow us to attract new businesses. But I think the first order of business is looking at our domestic businesses. Second one would be entrepreneurs through incubators that we have now, starting to emerge. I think of the ABI Innovation Hub in Manchester, in the Mill Yard. There's some great new businesses there. We're attracting venture capital and angel investors, non-conventional financing to support these businesses to take goods and services to marketplace. Those are New Hampshire people trying to make a go of it here in our state. Again, my bias would be towards them. And by the way, access to capital is a significant issue in New Hampshire for new startup businesses and relatively new businesses that were formed 2000 and afterwards. The New Hampshire Bankers Association did a survey last year and identified that as a real trouble spot in our state. There's been a credit crunch because of excessive regulations at the federal level. You know, the Great Recession was not caused by community banks in New Hampshire that's paid out or issued mortgages or commercial lending. It was a whole different market that they're trying to address through Dodd-Frank, but it's having a direct impact on us being able to access capital, our businesses. I just had a woman today ask me what I could do to help on that front. And I think it's very important we look at capital formation and access by working with conventional and non-conventional financing. And then, in terms of recruiting new businesses entirely to our state, I don't believe in subsidizing businesses. I think people should make decisions to come to New Hampshire because it makes business sense for them. But they need to know what's available here. And we don't do a really good job of branding New Hampshire at all. We sort of take it for granted that people know about us. When I think about Canadian companies that I've tried to recruit to our state, and when I go to Canada, especially Quebec, I can speak to them in their language. With a name like mine, you bet I can. And I ask them, you know, when they're looking to move into the United States, I say, why don't you think, how about New Hampshire? And the answer I get is, oh, we love New Hampshire. We go to Old Orchard Beach every summer. I'm like, Old Orchard Beach? That's Maine. And the response is, well, it's the same thing. No, it's not the same thing. We're different than Maine. We're different than Vermont. We have some attributes in our state that you need to know about. And we don't do a good enough job promoting New Hampshire. So part of the business development strategy for our promoters is to go out into the region and really start to target, micro-target potential businesses that would come to New Hampshire and try to find reasons to recruit them and locate them in a place that would make sense for them. But we need to start at home with the people who are here. That would be my priority.
Hello, my name is Peter Merrill.
Hi, Peter.
Hi. I want to thank you for coming here. I appreciate that, and I appreciate your service to the community over the years.
Thank you, Peter.
I want to address the issue you raised of block grants with the Medicaid. As somebody who spends a good bit of his time dealing with and responding to various federal regulations, I can more than appreciate why you might feel that they're a hindrance. However, as an employee of an organization that receives that money, I happen to think that the organization I need to be most fearful of is the state government. As an organization, it looks to me like the state has treated that revenue stream as something they needed to get their hands on, that they've manipulated that particular revenue stream as an attempt to skim off the cream and pass on to us maybe the skim milk. And as things have gotten worse, the state has balanced its budget on our backs, or more to the point, the backs of the people we care for. So when I look at the regulations on how we in the state get to spend the money, I'm seeing them as a protection, making sure that they actually come to the people who need the help. I'm not seeing them so much as a means of stifling innovation on how care can be provided.
Okay. Thank you for that question. Actually, you and I actually happen to agree on this. The reason I favor block grants is I want to have a relationship with the federal government that holds us accountable. We're going to say to Washington, give us this money on a block grant basis, but these are the 8 criteria that we're going to meet. We're going to use all this money for health care, not for balancing the state budget, number one. So we are agreeing to target those dollars where they belong with the patients of our state, the citizens of our state, for health care purposes. I've been always troubled by the fact that we've had this skimming or siphoning off of dollars that are intended for one purpose but being used for another purpose. So in the block grant model, you basically have this honest relationship, not games playing through a meta-scam type of approach where you say to the federal government, this is what we think we need to cover the lives of the citizens who qualify under Medicaid standards. And we're going to use all the dollars that we get for that purpose, number one. Number two, what we're going to do is provide access to health care through primary care and develop a system. You hold us accountable that we've done that, but we're going to be designing the model. Number three, we're going to reimburse based on whatever schedule we come up with. Fee for service, medical home, whatever the model is that we're going to try to design a reimbursement system. And again, have Washington hold us accountable to that. that's the relationship I foresee here. And people say to me, well, I don't trust our legislator. Well, you know, every 2 years we refresh the legislature by a third. I'd rather be able to go to Concord and meet with my elected official, state senator, state representative, or even the governor and say, this is what we're seeing as a problem, you know, at Dartmouth-Hitchcock Medical Center for purposes of this Medicaid program, rather than have to try to find somebody in Washington who I don't know. I don't know if they have any power. I don't know what they can do for me, but it's much more removed. I'd rather have it local with the people who are actually making decisions in my own state over the administration of this. I think in the end we're going to have a lot better results if we take control of really more of the healthcare dollars in our state than, again, yielding to policymakers out of New Hampshire. And this is where I'd want to work with you and people in this room rather than people in Washington to try to decide what it is that we're going to do to meet their bureaucracy or bureaucratic needs. And I think we can do that here in New Hampshire, and we ought to be doing it. And we're going to learn from other states, too. They're going to come up with different ways of doing things, and we're going to say, you know what, go back to Washington and say, you know what, we want you to know we're going to add this other feature we want you to hold you accountable to, or hold us accountable to.
My name is Neil Castaldo, and thank you very much, Ovide, for coming here. I'm one of the people who can vouch for your goodwill and flexibility in working with you.
Thanks,
from different perspectives. I'm a person who has voted for the current incumbent in each of his elections with decreasing enthusiasm. And it's gotten me to think about the job itself. So people have said that the New Hampshire governor job is one of the least powerful positions among governors in the country.
Yes.
Running for office must be absolute torture. Raising money, no time for yourself or your family. Criticism, appearing on the 6 o'clock
really?
news every night, makes me wonder why you would run for office. And I know I'm pretty sure it's not for the paycheck, and I'm pretty sure it's not because you want to live in the Bridges house in Concord.
Correct.
And so there must be a reason, Ovide, why, despite all of those problems, the prospect of dealing with 424 people, why is it that you want to get this job, you want to interview for the job and be awarded the position?
Maybe I should have this conversation with you a year ago. No. And it's not the license plate. No, that's true. You know, it's a very good question because I knew what I was going to get into. I knew what would happen if I won that primary. And I knew that third-party advertising would start and in a heavy way. I'm told by people outside of our state that this is the hottest race in the country in terms of the investment of money in the governor's race in New Hampshire. There are, obviously the presidential race cuts across, but not every state has a presidential race that's hot and heavy because somebody's already going to win, either Mitt Romney or Barack Obama. It's the battleground states, the swing states that are being really the hyper-focus of the presidential election. So add to that the fact that there's an open seat for governor here. Add to that you've got, we have a situation where we've had a Democratic governor 14 out of the last 16 years. And so the Republicans are interested in the seat. The Democrats are interested in keeping the seat. And the unions are out there, and other parties on both sides are out there watching to see what happens in New Hampshire because they also think that how the governor's race goes, so may go the presidency. I suspected that might be the case going into this race. I didn't quite know how intense it would be, and it is intense. I mean, my mother called me the other day, and she said, Ovide, I've decided I'm going to turn off my TV for the next 2 weeks. I cannot stand it anymore. I said, Ma, join the rest of New Hampshire, And then she asked me a question. She says, you're going to be the governor of New Hampshire. Are you going to be able to change the abortion laws in this country or this state? I said, no. She says, why do they say that about you? I said, because they have nothing else to say, because they want to scare people. There's a number of reasons why. But I believe in this state. And I think once we get past this election process, as imperfect as it is, there's a real opportunity to serve, Neil, to make a difference. And that's what I've been about all my life. I've been, serving in a number of capacities. I can see it, I can feel it. I know that our people are hardworking. And I know our people can make a better life for the next generation if we're given a chance to do it. And I have a vision for how that should be done. And it's not by passing more laws and having a lot more bureaucracy. It's by working with the people directly in the communities of our state. And I'm empowered by people. It's funny, you say, it's been a long year. I'm more energized today than I was last year at this time. Because I like working with people, because I can see it, I think I can bring some passion and vision to the governor's office to serve the people for some period of time, however long they'd have us. And if you're not in it to serve, this is not, like you just pointed out, a powerful office. It's not one that you get a big book signing because people want to read about your life's history after you serve a term or two. This is no stepping stone to anywhere else, really. And so my point is, I'm here to serve. I want to offer the people my skills, my talents, whatever they are, and to bring those skills and the passions to the governor's office to lead the people of New Hampshire in this state of ours, a state I believe in. And that's what it comes down to. It's that simple for me.
You referenced it, but the money that's being spent, the Citizens United decision, somebody told me there's going to be $13 or $14 million spent on the governor's race. A lot of it is ads that are coming from out of state that aren't campaign based, and I think Neil alluded to it too. There's got to be a better way, and what do you think that better way might be? I think everybody is just like your mother. That's a half-an-hour newscast, where you get 8 minutes of news and 12 minutes of everybody bashing everybody. And since it started like a year ago, it gets a little gubernatorial.
There you go, there you go. Very good job. I'm so into it. It's hard to be objective right now. I've got to step back and look at sort of how we all got here and what's been done. I think one of the problems we have in New Hampshire is that we've got such a short general election. You have a late primary right after Labor Day, right? And you've got 6, 7 weeks, maybe 8, that goes from that point to the general election. So the intensity is magnified. If our primary were held in May or early June, you'd have the summer to kind of gear up, plan. That doesn't mean you would have a lot of advertising, but you'd have a different dynamic. On primary night, Maggie Hassan's primary victory speech referred to me at least 7 times as a Tea Party candidate and all this stuff. The next morning, the Democratic Governors Association had a negative ad running. I mean, how did they know I would win? But anyways, they did, or at least they maybe had 2 ads. And it started the next day, and with a great intensity, and it hasn't let up. So I think it's the shortness of our general election cycle. I think the money is going to be there one way or the other. It finds its way through the system. I'd rather have complete disclosure, know who these people are. If anything, I'd say PACs, special interest groups, ought to disclose who their donors are so we can have a true assessment of this, who actually is behind these organizations. But in the end, you're going to have these kind of races every 2-4 years where there's a lot of intensity, for whatever reason, a lot of money spent. The good news, actually, in a way, is that neither Maggie or I are independently wealthy. At least I'm not, anyways, speaking for myself. So I can't put a lot of my money in. If you have a wealthy individual comes into our state, we saw that happen in, 2000, was it? 2002, we had fairly wealthy individuals spend a lot of money each, and it really had a very different feel to it. The money being spent now is from third parties in our race. Maggie and I have raised about the same amount of money, give or take a couple $100,000, but and as if that's no money, right? But that's what it is. It's a couple $100,000, give or take. So it's not millions of dollars in terms of differential. I don't think there's an easy answer to it, but I think disclosure has to be here. Sure.
Just to get back to healthcare for a moment. So the research here at Dartmouth shows that in reality, when you have a lot of providers or a lot of facilities, that tends to generate more procedures, more activity, more cost. And so if it were true that having more facilities competing with one another would lower costs, then New York City should have the lowest healthcare costs on earth. And we know that's not the case. So what real-world example can you offer in healthcare that would support the idea that eliminating certificates of need would actually reduce healthcare costs?
I haven't looked at other states where they've repealed the certificate of need laws to do a sort of a retrospective analysis. You know, my sense is this is the way the market would work. You might see in the short term more facilities offering a particular service than you think the market supports. But sooner or later, like anything else, the market would decide which services or which facilities are the ones that the people want to go to. And
That hasn't happened, is what I'm saying.
no, it hasn't, because it hasn't happened in New Hampshire because we have certificate of need laws.
Well, it hasn't happened in New York City.
Well, I don't know.
Boston.
Like I said, I don't know.
United States.
Yeah, it may have. I haven't had a chance to study that from elsewhere. But just looking at the ordinary economic dynamics you'd see in a free market system, you put too many hamburger stores in one neighborhood, some are going to survive and some aren't. It just has a natural winning way out aspect. You don't want to put those dollars up front and lose capital for a failing line, a failing service, but that's how the market would, I think, adjust for itself. You're going to have creaming to some extent, too, because you're going to have organizations will find a better, easier way to offer us a particular service that might take it outside of the regular hospital delivery system. In the end, that may lower costs because ultimately people may choose to go to that facility rather than to the local hospital. But I do think in free market, in the end, is going to be a better rationing dynamic or force than some artificial government manipulation is, and that's the bias I have in terms of health care.
No, I understand. It's just that it doesn't seem to be working that way.
Yeah.
So, I mean, you have a good it's a good theory.
Yeah.
It just doesn't, in the real world, it just doesn't seem to be working out.
Well,
So-
I need to go study that to
Yeah.
reach the same conclusion.
I'm
you
gonna.
have.
We have one more question, and
Okay,
then
sure.
we're gonna let Mr. Lamontagne go. Okay.
I'd like to get back to education for a minute.
Okay.
I
Yes.
sit on the budget committee with Mascoma School District here, and my concern is that I understand that the state is graying. How are we going to keep the kids that are going off to college coming back to New Hampshire and be having young families in a school system that's really antiquated? We can't live in one-room schoolhouses anymore.
Yeah. Well, it's a very good question, and I have a program called Learn to Earn, which is intended to do exactly what you asked, and that is, it's a public-private scholarship program statewide that would work with our employers and our educational institutions, whether it's vocational schools, community colleges, or four-year degree programs, where you'd have, for example, an employer, I'll take BAE, for example, which is a manufacturing company, essentially, down in Nashua and Merrimack. They're projecting they need 5 engineers over the next 5 years, every year for the next 5 years, to work in a particular department. They would fund part or all of a scholarship program. They get a tax credit for it in this program. They would make a commitment to a student who gets the scholarship that they would have a job at the end of their 2 or 4 year degree program. And that student would make a commitment they would take that job. So long as that student, as an employee, meets the workplace requirements and so forth, they'd be guaranteed a job and then agree to stay here, sort of like ROTC, except it's not ROTC, it's through a scholarship initiative. The reason I think that could be very helpful to us, too, is that it would help to align the interests and objectives of business and education. So the business would be working with local educators, for example, to make sure that student who's getting that degree program is getting internships at BAE or some similar facility, that the curriculum that's designed to help that student have the mechanical engineering skills that they're looking for is actually taught to them. And so we would be working together, business and education. Community colleges, I think, also offer a great opportunity to bring students right into the workforce. We need to retrain our guidance counselors, who are largely 4-year degree program graduates, right? They all are. And nothing bad about guidance counselors, but I think we're overlooking the whole new experience you have in manufacturing today. When you go to a manufacturing plant, you go to Charlestown at Wayland Engineering, they manufacture those lights that are on the tops of either police cars or ambulances or fire trucks. It's a specialty manufacturing. It's all computer generated. The engineers that work there and other manufacturers, employees in that manufacturing facility are highly trained, highly skilled. And yet we don't think about manufacturing as really a desirable outcome for the educational process. We need to start retraining ourselves and retooling ourselves in the end, people who come out of high school or community college that have a job will stay here. Some people do what I did. I'm a graduate of Trinity High School, went to college out of state, taught for 3 years, went to law school. But when we had our first daughter, we decided to come back home. I didn't realize it'd come back home next to my parents, but that's another story. But we did come back home. I want people to choose to come back here too after they've left for a few years, to know there's a job for them here, there's an economy that's worth making their life decision to come back to their home state. So it has to be a full spectrum effort. Then ultimately, elementary and secondary education, we need to get the bureaucracy out of that delivery system. We have too many SAUs, we have a lot of costs in bureaucracy, and there should be more money in the classroom for teachers, for equipment, and also online training and charter schools, a full array of a delivery system for our elementary and secondary education system. So there's a lot of work to be done there. But I think starting and working backwards so that we have students staying here after they're getting a college degree, whether a community college or four-year degree program, and then staying here as part of the equation, and then redesigning our delivery system for the lower grades.
Thank you, Ovid.
Thank you,
Thank you
Matt.
all for coming and participating today.
Thank you. I appreciate you.